Pronto International. It's a very good organization. It's staffed by doctors and nurse midwives. And what they do is they go into low resource areas and they help those birth attendants who, you know, those birth attendants are not looking at everyone getting a natural birth because it's going to be a beautiful experience. What they're trying to do is try and help make outcomes better. And so the doctors and nurses go in and they help train the people with the materials they have, try and get them resources for being able to help improve outcomes. So it does bother me when I see the midwives and doulas who go to an area that is not as privileged and they practice on people who are not privileged, but this may be their only chance of getting any care at all is through the study programs that these midwives use to practice on people. And that really does bother me that they're going in and training that way and saying, oh, this is so beautiful. Or if you read a blog for a student midwife, oh, we lost a baby, but it's just, oh, well, it was practice. That does bother me because if you really do want things to be better and you want to improve outcomes, you need to go in there and actually make the difference that's possible.
I get really bothered when the natural birth community, especially doulas who aren't trained, doulas who have nothing to do with the medical side of birth. Like we joke around about their job as ice chips and sandwiches, but it really is, they are a comfort tool for birthing parents. And it really bothers me when I see, especially doulas, but midwives too, discussing the horrible outcomes of birth in the United States for women of color, and particularly Black women, because women of color across the board are having bad outcomes in hospitals and out of hospitals with birth. Black women are having even worse outcomes in hospitals and out of hospitals. But a lot of the problems that lead to those outcomes start long before conception. So a midwife who's hardly trained isn't going to be the answer to that. And I am coming from a point of privilege. I grew up, I'm white. I'm like as white as snow in every capacity. I was lucky enough to have a father who was able to provide me with adequate health insurance my entire life, which is also something not everybody in the United States has. I have medical professionals in both sides of my family. I have actively had medical care and coverage and doctor's appointments and dentist appointments my whole life. Everything about my health, even my health problems, I come from a place of privilege. But it doesn't make it hurt any less when I see predatory midwives taking the point of their privilege and telling people who don't have those privileges that we are the answer to your problem.
Yeah.
Thank you. Because I've noticed when you look at a lot of the legislation and a lot of the things that midwives are trying to get passed, they always use the outcomes of the Black and brown pregnant and laboring people. And they say, well, look, we could improve that because look at our study of this. But what they're talking about is the people who normally use midwives and they are privileged people. Like you said, it's very privileged to be able to afford to have someone be there to comfort you and to listen to you and to rub your back. There is a lot of privilege in that. So you can't look at the outcomes that are bad and say, well, we can fix it with a doula, but yet they're using that to try and tie it in, to get Medicaid to pay for it, to get health insurance to pay for it. And right now we don't have enough people in the United States that are covered by any decent sort of health insurance to start looking at those extras and saying, yeah, let's do that, because it turns into a cost-cutting measure. And I don't like that. People shouldn't get certain things, especially for doulas that are an extra. Oh, well, it'll cut costs. I don't like that. Let's get everyone covered first. Let's get everyone taken care of. Let's get those outcomes under control before we start looking at someone who's not medical. You don't throw somebody untrained. That's so, oh, I hate that. I hate that they're throwing untrained people at a situation like that because it's just another, oh, you'll be fine. You know,
Hmm.
you can ride the bus now. That's what it sounds like to me.
But a common
Yeah.
that we talk about in these videos that Danielle has set up is the lack of adequate prenatal care that a lot of midwives provide. It's not just adequate prenatal care that sets a person up for a successful pregnancy, labor, and delivery and transition into parenting. It is total body, whole life health that brings people as close to those success stories as we can get. And unfortunately, a lot of the people who suffer the worst outcomes of birth in the United States also are people who have been denied or do not have access to adequate health care before they get pregnant. There's underlying health concerns that have never been noticed because a lot of people aren't going to the doctor regularly. There's people, even in my town that I grew up in, which I live in a rather affluent suburb of my city. Our NFL team plays in the town that I live in. So we have like literal mega millionaires all over my town and lots of like doctors. My family kind of like the black sheep where we had to like scrape by to get here, but it's a great school. And my mom and my grandma wanted me to live in a good school district. And even in my school district, there were some of the kids who didn't have a lot of money and their parents couldn't provide them with like health coverage. They were only seeing a doctor if they needed a physical to play a sports team. So if we're experiencing that in a rather whitewashed, affluent suburb of my city, and I live in New York State, so health coverage is rather readily available to a lot of people based off of socioeconomic standing. That's not the case in other places. That's not the case when you go into other states that run it differently. And whether or not you agree with how New York does it or you don't, we do have good healthcare readily available with resources for people to navigate it. And if you're somebody who hasn't been able to maintain adequate health care throughout your life, and then you get pregnant and you wind up in the care of a midwife who's not going to be doing adequate testing on you, adequate studies on you. What if you have anemia that you've never known about and your midwife never checks it? What if you have a clotting factor problem that you've never known about? Your midwife isn't checking for that. What if you have a sacrum that does not move because of an injury you sustained when you were a teenager? Your midwife is not checking that. Most midwives aren't even doing pelvic exams throughout the duration of your pregnancy or labor. So how can these people who have no idea what your whole life health looks like, who are not doing adequate testing, how can they be the guarantee that you are going to make it safely to the other side? Hospitals need to change. I know that there is hard statistical data that proves that women of color and Black women are oftentimes misunderstood by doctors. Doctors assume their pain isn't as bad as they're saying it is and things like that. Those things need to change, but going to a lower resource, lower educated, lower staffed, lower equipped, like everything is lower in the midwifery model of care. And like Danielle and I know, the scrutiny of peer review that exists within a hospital, where if you've got RNs sitting there being like, we see the writing on the wall, something's happening here to this mom and this doctor's not doing enough about it, they're going to go get somebody else. There's more doctors to get involved. There are more nurses to get involved. In a hospital, you can fire your nurse, you can fire your doctor on the spot. You're not listening to me. I don't feel heard by you. I don't feel safe with you. I don't think that you are going to help me do this safely. And you can get a new doctor. You can't do that with midwifery. And midwifery is never going to tell you that you need something better until your baby's dead.
It's true. Do you want to know something that's always bothered me? I've grown, I mean, my life's been good. Let's say that. My life has been good, but I spent many, many years of my life with no insurance. I didn't have insurance when I got pregnant with Gavin, actually. I didn't have insurance. So I do understand that the lower class status. I was just working. And if my job provided insurance, I accepted. If it didn't provide insurance, I didn't have insurance. That's literally how I lived my life. And I can tell you that in my 20s, I knew from my mom and from my grandma and from my cousins that were girls and females and whatever, we were all like, you have to go get checked out because you don't want to get cancer and you have to catch it at a certain time or it's going to get really bad and you can die from it. So we knew these things, like your body needs to be getting checked. And so I was getting PAPs and getting exams and getting all these things done. And then as it turned out, and by the way, I didn't have insurance. So I was going to Planned Parenthood. I was going to the local places that you could go that have like a sliding scale to pay cash. Like I went wherever I could. I didn't get to go to a regular doctor, gynecologist because I couldn't afford them because they were highly expensive to go just get an exam if you didn't have insurance. So I went to the normal places that was in my county, in my state. And I can tell you that a lot of my friends though, were not getting these exams at all. And I was like, what do you mean you haven't had an exam ever and you're 25? And these are things that I started realizing just talking to my own friends. And some of them were like, they went to college and they did they just didn't even know their own body health. They didn't even know that they needed to go and be checked out. They were like, oh no, that's when you get older and you need mammograms. And what I'm like, no, we need body checkups. We need to be making sure do you have different partners? You need to be checking on that too. There's a lot of things we need to take care and maintain our bodies and know what's going on. And I realized the more that I started talking to my friends about it, the more that I realized a lot of us were not going in, not getting birth control, not getting checked out, nothing was happening. We were just kind of floating along, just doing our thing. And and I can honestly tell you, sadly, a couple of my friends lost their ovaries. A couple of my friends got into some, they just didn't know. And by the time it got to that point, this is what we have to do. We have to do drastic things instead of doing the things that could have been, fix it here, fix it there, whatever. They had to really do some major things. And that's something that I always thought about, growing up, I was in my 20s, whoa, my friend's losing her ovaries and she's younger than me. That was really astonishing to me. And so I have to think about when my state wants to push these things to help lower class, families, to give them prenatal care and all this stuff. We're not getting prenatal care from midwives. We're not getting it from doulas. They're not checking you for diabetes properly. They're not doing proper testing if they're doing any testing at all. Maybe you pee in a cup and you might get your glucose levels, which you can buy from Amazon and test your own pee anytime you want to for glucose, which that's pretty much what the midwives do. They buy these test kit things from Amazon or online of these other places, but they can't really read it because they're not actually medical. Or I've heard things where the things different for glucose, but you're getting misdiagnosed by the midwife because they don't understand it. They're not medically trained, or they're like, well, it could be high today, but it might not be high tomorrow. And we'll just test you in a month. Okay, but it could have been something that was serious. So these are things I always think about that, looking back at my own appointments, looking back at all this stuff of whatever, I never got real medical care until I started having babies. And I started actually going to the gynecologist and the OB, and I actually was getting treated I wasn't a number anymore. Oh my gosh, I'm a baby maker now. So now now we have to like check us out kind of thing. But it's weird, like thinking about it, like I didn't go to the doctor. I didn't have a primary care doctor. I didn't get blood work done. I never had anything happen. And I hate to say, but that's where I was. And when you're talking about this lower class people, like that's where I've been. And you can't I did the midwife thing. It did not work out for me. Like, don't just toss them the bottom of the barrel and say, hey, maybe this will be better for you. No, improve what we already have. We have the systems, we have the buildings, we have the staff, like improve that, make it better, educate us more. Women need more education. We need more information out there that like, I can't tell you how many people I knew that didn't have insurance, of all colors, by the way, of all everything. And that they didn't know that in pretty much every single state, you can go to your health department and get a PAP done and get birth control for free. Like there's a lot of things that women don't know. Like there's a lot of things that are offered for free and we don't even know about it because we don't talk about it. And it's kind of sad. Like, and I'm thinking about my own state wants to pass laws to hand over a license to CPMs and lay midwifery and whatever, and their assistants and all this stuff, but they're not good enough care. They're not good enough care because exactly like you said, if we've never been to the doctor before, and then suddenly you have a midwife because you're going there for prenatal care is very important. You can find a lot of things out before you get that far enough till we get to the birth. We can do a lot of things before we get there, from the things that they're checking for, the way that they're testing us, the way they're checking our bodies. And I actually remember when I had my rainbow from my, after my midwife experience, my doctor would come in and she would like move my arms and move my legs and move my feet. And I was like, what is this? Because I never experienced it before, but she was like legitimately looking for stuff that even though my testing was coming back that everything was normal and fine, she was like, I got to check you for this. Oh, good. This is good here. Like, these are good nerves here. Like she was on it. And I have to say, like, it's such a different level of care because they don't know any of that stuff. They don't know what's going on. I mean, it sounds bad, but I remember being asked with my midwife when we bought our birth kit, do you want to know your baby's blood type? You don't have to, but we can do it. We have to give your baby a poke and it goes on a little card and whatever. I remember that it was my choice to find out my baby's blood type. And I was like, yeah, I want to know my baby's blood type. And then she made it like it was a horror story. We have to poke the baby and I don't like doing it. And maybe I'll get the assistant to do it. Like she didn't even want to do it. And I was like, this is my kid's like blood. I need to know if something happens. I need to know what blood type he is. Like, this is important. But it was like that. That's kind of the care that they don't realize is out there.